group was Joy Baker and Courtney Hunt. Bursitis is an infection of the bursa sacs, which means that they are in between like major joints like your knees, your shoulder, your hips, and they really reduce friction between the joints, and they can get inflamed and infected. Some common locations would be your shoulder, and your shoulder bursa is near your humerus and where the tip of your shoulder joins. It's also where you can find your rotator cuff and your labrum. You can also find it in your elbow, and it is where the humerus, ulna, and radius all connect, and again, it just reduces the friction between the joints. The last major location would be your hip, and there are two locations for the hip. The greater trochanter of the femur, which means that it's a little projection of the femur, and then also the other bursa sac is found near your groin. Some symptoms that someone might experience when they have bursitis would be being achy, stiff, or having increased pain when exercising or moving, and looking swollen or red, or experiencing loss of movement in like daily activities like kneeling, stuff like that. Some causes and risk factors would include repetitive movement of positions that put pressure on bursa, and you can think of like kneeling as one and stuff like that, or throwing or lifting an object above your head will also be another one. It's hard on your shoulders and your elbows. Leaning on your elbows, like leaning on a table, could also affect your bursa. Injury or trauma. People that are in car accidents are more likely to get bursitis because their joints have a lot of pressure put on them, which then inflames it and really makes it mad, and then you can get infection. Then you can also have inflammatory arthritis, which, if you don't know what arthritis is, it's just your joints don't work how they are supposed to. Your age does play a factor into getting bursitis. The older you are, the less your joints are going to be able to move and fluctuate. And then occupation or hobbies, people that work construction are more likely to get bursitis because they're kneeling, they're lifting things heavy above their head, and then other medical conditions like rheumatoid arthritis or diabetes. For you to assess and diagnose bursitis, you would have to do a physical exam, and that would include like looking to see if it's swollen, red, or warm in that area, like your knee, your hip, your elbow, anywhere. You also are going to look for bumps underneath the skin, and then you also need to examine the history of the pain. You also need a medical history, because the more that you have bursitis, the more you're going to have it occur again, and you also want to know when the symptoms began, because it can be something else. MRIs, x-rays, and an ultrasound can also rule out other common diseases or disorders like tendinitis. For your treatments, there really aren't a lot, but you can ice. They recommend icing for 10 to 15 minutes every 2 hours. It's really important you do it every 2 hours. You also want to take Tylenol, ibuprofen, stuff that's over the counter. If it's bad enough and the doctor believes that you need antibiotics, you can go into hospital and do IV treatments, or you can take a pill form. If it is super bad, you can do surgery, and they can just remove the bursa sac, and then it will get rid of all your problems with it. They only like to do surgery if it's a repetitive history of it. They don't just like to pull those things out. It is really important that you prevent bursitis, because it is super painful and you really just don't want it, but you need to learn proper posture and technique for your activity. You also need to avoid sitting or kneeling for a long period of time. Maintain a healthy weight to reduce the pressure on your joints, because if you have a heavier weight, then you are going to put a lot of pressure on them joints, and then it's also going to compress the bursa, which is really painful. You want to ease into new activities, especially older people need to ease into new activities because it can be harder on the joints. You also need to take breaks if you're doing a repetitive task like gardening and stuff like that, where you're on your knees all the time. For a prognosis, you have to make adjustments to your daily life. and it leads to the best outcome. Bursitis is not deadly, it's nothing serious, but it is usually short-lived, but it can last a few hours to a few days, and if it lasts a few days, you really need to go see someone. And repetitive flare-ups can cause damage to the bursa, which then they would want to do surgery to, because the bursa can't just redo itself, if that makes any sense. And then you can look at more sources. I looked at the Cleveland Clinic, Mayo Clinic, WebMD, and others.